Hi guys, hello everyone. Today I am discussing about the standard precautions. Standard precautions for infection control in hospitals. 6 standard precautions. Standard precautions. Standard precautions are the basic infection control practices which must be to while caring any patient in hospitals. Standard precautions should be taken in all kinds of patient care process. They are also called as universal precautions. 6 standard precautions in that elements of standards precautions are standard precautions. 6 elements of standard precautions. Hand hygiene, personal protective equipment, handling of needles and sharps, respiratory hygiene and cough etiquette, waste disposal, sterile instruments and devices that are used in hospitals. First one is the hand hygiene. I am explaining about the all six elements. First one is hand hygiene. Hand hygiene. In that, hand hygiene is perhaps the most important aspect of standard precautions. Hand hygiene include hand washing of 40 to 60 seconds with soap and water must be used when hands are visibly dirty and contaminated. Healthcare workers must clean their hands before and after every patient interaction, as well as after any contact with blood, body fluid or contaminated surfaces. Hand hygiene, another one is hand sanitizer. Hand hygiene in that alcohol rub. Based hand sanitizer are typically used for all routine hand hygiene. Second one is the PPE. PPE means personal protective equipment. Use of gloves, mask, gowns, face shields and eye protection or goggles. Use of gloves while you touching blood, body fluids. Mask used for facial protection of nose and mouth. Gowns must be used to generate splashes of blood, body fluid or secretions. Face shields. Face shields also used for facial protection and generate splashes of blood or body fluids. Eye protection or goggles. Generate splashes of spray of blood, body fluids, secretions and excretions. Healthcare workers must be used by PPE when they are in close contact with patients or when they are performing any procedures that could expose them to blood or body fluids. Third one standard precaution is handling of needles and sharps. Proper handling of needles and sharps are to prevent needle stick or sharps injuries. Do not recap needle. Dispose used needles and sharps in a puncture-proof container. And fourth one is the respiratory hygiene and cough etiquette. Person with cough and cold must cover their nose and mouth with a tissue or mask when coughing or sneezing. To use tissue and mask must be disposed to closed bin. Hand hygiene must be done immediately after that. Patients with respiratory symptoms must be placed at least 3 feet away from other patients. Next one is the fifth one is waste disposal. Biomedical waste are infected and should be handled in accordance to biomedical waste management and handling rules. Handling rules are segregation, transportation and incineration. Categories of waste: human and anatomical waste, recyclable waste, waste sharps, glass items and glass materials. We are going to human and anatomical infected waste, we put in yellow bucket. Recyclable plastic waste, how to do in red bucket. Glass items and glass materials, blue cardboard box. Waste sharps in that all the things waste sharps, white puncture-proof container. General waste, wet waste and dry waste. Wet waste is the food materials and kitchen items and kitchen wastes. Dry waste means all paper items. Sixth one is the sterile instruments and devices. In hospital settings, in that sterilization and disinfection of patient care items and devices. We visited all instruments and devices must be autoclaved and used procedures. Disinfection done in all procedures areas. Autoclaving should be 121 degrees Celsius, 15 pounds, 30 minutes pressure. These are standard precautions used in hospitals to reduce the spread of pathogens between patients and healthcare workers. This includes protection from blood and body fluids, non-intact skin and mucous membrane. Thank you all.